Today, we are taking a deep dive into one of the most intense and fascinating substances known to modern science, 5-MeO-DMT. You've probably heard it called the God molecule, and honestly, it presents this truly staggering duality. On one hand, we're looking at incredible rapid-acting therapeutic promise, especially for treatment-resistant depression. But on the exact same token, it carries real, potentially fatal risks if it's mishandled. It is quite literally a molecule of extremes. So to really understand how it works, we need to look closely at both the promise and the peril.
Okay, let's dive into this. Here is our roadmap for demystifying this Schedule I substance today. First, the God molecule explained. Second, the neuroscience of the whiteout. Third, a rapid antidepressant signal. Fourth, real and unforgiving risks. Fifth, the toad versus synthetic. And finally, number 6, the honest bottom line.
All right, Part 1, the God molecule explained. There is so much intense mythology and so many street names surrounding this powerful compound. And, that can sometimes totally obscure what it actually does to human consciousness. So we really have to ask the basic question. What exactly is the God molecule? What makes it so chemically and experientially different from, virtually every other psychedelic out there?
To really wrap our heads around this, it helps to compare it to its famous structural cousin, DMT. Now, DMT is incredibly visual, right? It opens a door to these kaleidoscopic worlds, geometric dreamscapes, encounters with entities. But 5-MeO-DMT, it essentially erases the door. It erases the walls, and it completely erases the self. Instead of this wild light show, it produces a formless void, a blinding white light, and a total loss of ego.
Which brings us to Part 2, the neuroscience of the whiteout.
Shifting from that mystical experience to the hard science, the pharmacology here is absolutely fascinating. Basically, every classic psychedelic you can think of, like psilocybin or LSD, relies heavily on agonizing the 5-HT2A receptor in the brain. But 5-MeO-DMT is a dual agonist with an extreme bias. It binds the 5-HT1A receptor with roughly 300 times stronger affinity than 2A. And researchers actually hypothesize that this incredibly strong 1A tilt is exactly what drives its unique non-visual state of deep autonomic surrender. And that leads us to what is clinically referred to as the whiteout. It's defined as a near-total collapse of the sense of self, space, time, and object boundaries, all dissolving into a unified field of consciousness. When researchers measure this on validated psychological scales, 5-MeO-DMT produces exceptionally high ratings of oceanic boundlessness and ego dissolution. In fact, it is widely considered to produce the absolute most complete and often the most overwhelming ego death of any known psychedelic. It's essentially a pharmacological route to deconstructed consciousness.
And the kinetics of this experience, they are a true sprint. When it's vaporized or inhaled, the onset arrives in mere seconds. The peak hits anywhere between 8 and 15 minutes, and the user returns to baseline in just 30 to 45 minutes. I mean, there is virtually no on-ramp here. It is one of the fastest, sharpest psychedelic arcs known to science, which is a huge part of why the intensity can just feel so overwhelming.
Let's look at Part 3, a rapid antidepressant signal.
Pivoting to the clinical potential, the pure synthetic form, which is known generically as mebufotenin, is currently being tested in mid to late-stage depression trials, and the data is highly, highly compelling. GH Research ran a Phase 2b trial for inhaled GH01, and they saw a placebo-adjusted drop of 15.5 points on the MADRS depression scale at day 8, alongside a 57.5% remission rate. Similarly, Beckley Psytech and Atai Life Sciences reported a 12.1-point reduction at day 29 for their 8 mg intranasal dose of BPL-003, and that's actually now advancing to Phase 3. So while this is still pre-approval, this rapid antidepressant signal is undeniably profound.
So how exactly is it pulling this off? Well, preclinical work shows that a single dose drives structural neuroplasticity. Specifically, it increases dendritic spine density in the frontal cortex for about a month. It does this by engaging those intracellular 5-HT2A receptors, which then activate the BDNF-TRKB and mTOR pathways. If you're not familiar, those are essentially the brain's core growth and repair networks. It harnesses the exact same plasticity engine as other classic psychedelics, physically wiring the brain for lasting positive change.
Moving to Part 4. Real and unforgiving risks. We really need to deliberately slow down here for a second, because outside of a screened, medically monitored clinic, 5-MeO-DMT is physically demanding and completely unforgiving. There are absolute contraindications you absolutely must be aware of. Uncontrolled cardiovascular disease is a massive red flag. mostly due to transient tachycardia and elevated blood pressure. But even more critically, it absolutely cannot be combined with MAOIs, and yes, that includes the harmala alkaloids found in ayahuasca brews or serotonergic drugs like SSRIs and SNRIs. In unregulated settings, ignoring these rules has literally been fatal.
Let's quickly break down the biological mechanism behind this danger. 5-MeO-DMT is inactivated primarily by the enzyme MAOA in your body. So if you take an MAOI or combine it with an SSRI, you are actively blocking the very mechanism that clears the drug out of your system. This raises levels dangerously high and risks precipitating serotonin syndrome. That involves hyperthermia, severe muscle rigidity, agitation, and extreme cardiovascular strain. It can absolutely be lethal. This is exactly why professional medical screening and real-time vital sign monitoring are entirely essential.
All right, part 5, the toad versus synthetic.
When we look at the origins of the molecule, it's really important to compare the trendy underground source with the pharmaceutical standard. The natural source is, of course, the venom of the Sonoran Desert toad. However, we have to recognize that this venom is a chaotic, crude mixture. It actually only contains about 15 to 25% 5-MeO-DMT, and it's packed alongside cardiotoxic bufadinolides. On the flip side, the pure synthetic mebufotenin provides 100% purity, precise medical dose control, and zero animal-derived cardiotoxins.
And beyond just physical safety, there's a severe ecological issue happening here. The huge boom in underground bufo ceremonies has put massive population pressure on these wild toads. Herpetologists report there is basically no ethical way to milk them, they only secrete the venom under extreme stress, and human handling spreads a deadly chytrid fungus. The synthetic version is not only safer for the user, but it avoids this ecological harm entirely. And just as a quick final reminder on legality, 5-MeO-DMT remains a Schedule I controlled substance federally in the U.S., and it's notably excluded from most state decriminalization frameworks, including Colorado's Proposition 122.
Which brings us to our final section, Part 6, the honest bottom line.
To quote the source material directly here, the most complete ego death also carries some of the least forgiving risks. 5-MeO-DMT demands profound respect. It holds just staggering potential to rewire the depressed brain through rapid neuroplasticity. But its speed, its sheer intensity, and those strict contraindications mean it is never to be taken lightly. As science continues to uncover the mechanics of this ultimate surrender, it leaves us with one really critical question to ponder. Is modern medicine truly ready to integrate an experience this overwhelming into standard psychiatric care?